Hi everyone, I'm Dr. Ipshita Suyash and I'm a pediatric dentist at Toothish. I'm also a orofacial myofunctional specialist where I help children breathe and sleep better as well. Today I'm going to discuss a topic called thumb sucking, which is very commonly seen in children. So thumb sucking is actually a developmental process which is seen in 2 out of 4 infants. But when it progresses and it does not stop, that's when we have an issue. So thumb sucking is seen commonly in fetuses, even in 12 weeks of an ultrasound. So it looks very cute, but when it progresses, like I said, there is an issue. It is a natural rooting reflex where the child puts their thumb or any finger in their mouth and will suck on it. It helps them feel secure and comforts them when they're a little not sure of what's happening. But when the habit progresses and when the comfort becomes a habit, it can be a big issue if such a big baby has a thumb in their mouth. So children who have a thumb sucking habit have seen to have low self-esteem. They have developmental delays and have awkward faces. So here's a little presentation to show you exactly what happens when a child is thumb sucking. So the moment the child places a thumb in the mouth and sucks on it, there is a pressure created near the face or basically the lips of the child. There is flaring or basically forward movement of the front teeth, because of which there is an open mouth posture which is developed in the child. Apart from this, because this area, which is the corner of the mouth, is always moist because of the saliva, there is rash which is seen. Also, there is a very long face which develops. These are commonly known traits which is seen in children who have thumb sucking. But because there is a thumb in the mouth, the child develops something called an open mouth posture. So 70 to 75 children have the habit of sucking their thumb and going to sleep. So once they're asleep, their mouth is open. When the mouth is open, the tongue is placed down, like it is seen in this video. What happens is the tongue covers the remaining teeth and there is pressure when the child is sucking from the cheeks. This pushes the teeth inside, which makes the upper jaw narrower. So a beautiful jaw becomes crooked. Now the upper jaw is actually the floor of the nose. So if the upper jaw becomes narrow, there will be a little bit of pressure put in the nose. This will prevent the child from normally nasal breathing. Child will lead to becoming a mouth breather. Apart from this, there are various other habits that the child may develop. One of them is tongue thrusting. So when the tongue is laying low and there is thrusting, this is what happens. There is a gap which is created in the front teeth. So we get to this kind of a situation. Children require thumbs to go to sleep. They develop an open bite and the teeth, the back teeth, go inside. So that's called a cross bite. So there are various developmental issues that happen because of which the jaws become narrow, the teeth become crooked. There is also a breathing issue and their sleep patterns are disturbed. So the main question is, what do you do? Now, if it's in an infant, for example, in a 2 to 3 month old baby, it is totally fine. It is commonly seen and I would even encourage it because it is one of the first motor activities that the child learns to do on their own. But when your child is developing primary teeth and they start erupting in the mouth and this habit prolongs, we need to at least understand why the child is thumb sucking. So most importantly, don't yell at the child when they thumb suck. The most common thing that is done is pepper is put on the thumb, or there is something which is foul tasting which is put on the thumb. It rarely really helps. Yeah. So the child still puts the thumb in the mouth or will wait for the taste to go off and will continue the habit. What you can do is you can talk to the child, understand where this want of thumb sucking is coming from. There will be certain situations where the child will not thumb suck. So the child might not thumb suck when there is some person in the room, or if he or she is playing with some friend, or will not thumb suck in some part of the house. So when you become more conscious of when that is happening and you report it back to a pediatric dentist or a specialist, we'll be able to tackle the issue better. So what else can you do? You can accessorize. So instead of shaming them for thumb sucking, you should actually encourage them with gifts. So how that works is there are certain socks or t-shirts or even bandages which look very cool. They prevent the child from putting the thumb in the mouth. Eventually, slowly, they forget the habit. If that doesn't work, there are appliances as well which are given by dentists. Uh, but the new research shows that if the appliance is causing the child pain or is hurting the child, not just physically in the mouth, but as in emotionally, it could cause issues. What I really recommend is retraining the tongue. So in my clinic, we have thumb sucking programs, which starts from about, so it's like a 4-week program to a 12-week program where we play with the child. We teach them certain games, which helps them forget thumb sucking totally. What we do is we retrain the muscles of the lips. We retrain the way the tongue is positioned. We also teach them a better way to breathe. When we do all of this, we are able to help them overcome the habit of thumb sucking. I hope this has been a little bit of insight to the entire aspect of thumb sucking. I'm happy to answer any of the questions which you all have. So let's hear our first question. Okay, so somebody's child is grown and is still sucking their thumb. So like I said, if I could have the age of the child, it would be great. So if the child is 2 years, you should understand when they're thumb sucking. If the child is thumb sucking only while sleeping, then introduce other things to help them sleep better. So you have sleep routines, changing the environment in the room, ensuring that the temperature is regulated, talking to them, reading to them, playing certain music can associate them to sleep instead of the thumb. So they can let go of the behavior. So the other question is, if it is a normal behavior, why should it be concerned? So it is something to be concerned if it prolongs. So it is a rooting reflex till the child is an infant. That is, I would say, 8 to 9 months, it's a rooting reflex. After that, you have to understand if it prolongs, there is that much of pressure being put on the face, that much of time the child will take to forget the habit. It looks shameful. Children start getting bullied. They have self-esteem issues. They can't talk. So there are developmental delays. Hence, it is something we have concern for. When should we be concerned about it? We should be concerned after the age of 4. So if your child is 4 and is still thumb sucking, not just in the night, but even in the day, definitely please see a specialist. Okay, so what can I do if my child will not stop thumb sucking? Okay, so if the child is not stopping to thumb suck, like I said, we have to come down to what is the cause which is making him thumb suck. So if he or she is doing it out of, if he or she is doing it for comfort, then you try and get them to get engaged in other things, right? So we talk to them. We understand why are we thumb sucking. That's one. Second, having them stop, we can use accessories, like I said. We can also use games. So this will help them forget the habit. And thumb sucking can cause dental problems, like I discussed. There will be crooked teeth. There will be habits which will cause the muscles of the face to weaken, which will further cause breathing issues and sleep issues. Okay. Okay. So how long does thumb sucking usually last? So it varies from baby to baby. Some children forget thumb sucking in their 6th to 7th month. Some children take 2 to 4 years. If it is, even sometimes when they forget thumb sucking, and if there is a stressful situation at home or in school, they can restart the habit. So we have to keep a good check. So after the age of 5, usually thumb sucking does not start. But till the age of 4, if your child has a history of thumb sucking, you need to definitely keep it in check. Okay. Okay, so your daughter is 6.5 months old. It is very natural and normal for children to suck on their fingers, make it a fist. They'll do it a lot during teething as well. Right now, I would advise you to not worry. You can remove her hand every time she puts it, but you need to, substitute with something else. Don't just remove it. She's not going to like that. So ensure you give her something to play with, or you give her attention. Sometimes that could also be because the child wants attention. Yeah. So how it can be stopped is you substitute, right? So you either give her something to play with, or you give her attention. A lot of mothers provide the breast to make the child stop thumb sucking. This is for 6.5-month-old. Okay, so the next question is, okay, so if your child is 22 months old, almost 2 years, and has been thumb sucking for 3 months, definitely you should get it checked, because your baby will have milk teeth. When the milk teeth come and thumb sucking has not stopped, like I showed in my presentation, there are few issues which happen in the teeth. You will have a gap which you will see. You will see the upper jaw to be flared out. You will also see the lower jaw to be narrow. So definitely have it checked. Why do children suck their thumb? Like it's not just humans, right? A lot of primates. It's the most innate or inborn reflex that is there in all primates. So chimpanzees have it, babies, humans have it, many other animals have it. So it's an innate rooting reflex. This is actually two reasons. One, it's a motor activity. So when you learn about, you have hands and you have toes and everything as a baby, you're figuring out what the world is about. So when you figure, okay, I have hands, and if I do this, I can understand what it is, they end up putting it in their mouth. So it's a reflex that is learned. It's a motor activity, and that is why they suck their thumb. Okay. The next question. The dental effects I mentioned, apart from having crooked teeth, they also have a high risk to allergies as well, because they develop a mouth breathing habit. And when you have a mouth breathing habit, you're more prone to inhaling all the allergens in the air, because your air is not getting filtered. Okay, my daughter is 5 years old and okay, always keeps her fingers in the mouth. Okay, so at this age, this is a perfect age to actually, get them into a program where we can talk to the child and understand why exactly this habit is persisting. At this age, we also know that the tongue is not sitting in the right place. Now, when I say tongue is not sitting in the right place, the tongue is supposed to sit in the roof of the mouth, because there are certain receptors which are released by the tongue touching the roof of the mouth, which causes the child to relax and feel at ease. When this is not happening, everything else is substituted. So a lot of children put fingers, pacifiers, can also put corners of cloth, right? So basically, what is it doing? It's just going on the spot and getting that comfort. So if that is the issue, what we do is we substitute. We give food items for a lot of children. We give a lot of jellies, which is vegan and is not got any sugar, so there's no problem. That helps them forget that they need to put something else, because we've already covered that area. Yeah. So that's all the questions. Okay. The next question is, okay, Pooja. So yes, 2 years old, still thumb sucking. It's quite messy when children, make a mess of their hands and fingers, a lot of saliva dripping. So apart from stopping, one, you should ensure that you're moisturizing his lips, because there could be rash which develops on his corner of his mouth. The other thing that you can do is you can try and give him something else to play with. That really works a lot. There are certain caps that we make for their fingers with their favorite toys. So because they're adoring it so much, they forget to put it in their mouth. They're just looking at it. That also works. Yeah. Okay, the next question. Okay, great. All right. So that works. So more on the whole, I'd like to just say In babies, that is till the age of 8-9 months, it's normal. It's a rooting reflex. You don't need to worry about it. When your child starts getting primary teeth, definitely ensure that you're able to detach the habit, especially when they're falling asleep. Otherwise, they will continue to do that, especially when they fall asleep. At the age of 2 and 4, very good time to meet a professional to help your child overcome this habit. Dental issues start happening after the primary teeth have erupted, so you would want to keep a check for that. Apart from that, any more questions you would have, I'm happy to have them answered via email. Thank you so very much.